Hey there, this is Farrell David. I'm one of the educators at UHC, and what we're going to do today is talk about moderate sedation. Um, Procedural sedation is a real good terminology for this as well. We're going to discuss all the requirements for minimal, moderate, and deep sedation today. Medications that are used during the sedation processes, and also the requirements for each. So let's start off with talking about minimal sedation. Minimal sedation is considered when we use less than 5 milligrams of Versed IV, or at least less than 20 milligrams of Valium IV for these patients. Whether they're pediatric or adult, we still consider this minimal sedation. For minimal sedations, consent is not required for the process or for the sedation to be used. For the process, it would be. In adult sedation, you do not have to be, the RNs do not have to be in continuous presence of the patient during the procedure, but you have to be available. And you need to check on your patients every 15 minutes for a level of consciousness, whether or not the patient continues to have protective reflexes, and if they have a normal breathing pattern. For pediatric patients in minimal sedation, you need to be in continuous presence of the patient and do vitals every 5 minutes until the last dose, 15 minutes after the last dose of medicine. Post-procedure, 30 minutes after the last dose of medication, if the patients have returned to a pre-sedation level of consciousness and their vital signs are within 20% of baseline, you can send them home. Adults, you're going to tell them not to drive, don't drink alcohol, or don't use heavy machinery for at least 24 hours. Okay? All right, so that's it for minimal sedation. Moderate sedation is when we're going to use either a combination of these drugs or narcotics and anti-anxiety meds, or if you do combinations, either way. You use more than 20 milligrams of Valium or more than 5 milligrams of Versed IV, then this would be considered moderate sedation. Only nurses who are credentialed in the use of these medicines and these doses for this procedure, those competency to do moderate sedation, are allowed to actually administer the medications here. Now, the guidelines for this is you want to go ahead and make sure that you get a consent form. Be sure that your patient has not had anything to eat or drink for the last 6 hours. If they have, and the doctor's aware of it, and he wants to continue with the procedure, then he should declare this an emergent procedure. You as a nurse are going to be dedicated to the care of this patient, and that's going to be your only responsibility. Make sure you get ready to call a timeout when right before the procedure starts. Make sure that everything is appropriate. You need equipment at the bedside. You're going to have O2 on standby. You need a crash cart for age-appropriate crash cart for these patients there, and IV. Naturally, you're going to need an IV already started. These patients, you're going to stay at the bedside, and you're going to monitor their vital signs every 5 minutes until at least 15 minutes after the last dose of sedation is given. At that point, you no longer need to stay at the bedside, but you need to go back every 15 minutes for at least an hour and check vital signs. After that hour, if the patient is doing well, he's alert, appropriately responsive, and his vital signs are within 20% of baseline, you can discharge him to home. However, if he's received the reversal agent for narcotics or benzos, he's got to stay at least 2 hours before we can actually discharge him to home. Okay. Next thing is deep sedation. Now, deep sedation, the medicines are a little bit different. Deep sedation, we talk about the use of Diprivan, we talk about Brevitol, ketamine, and etomidate. These medicines are used in deep sedation. They are not medicines that RNs with this credential can actually administer. Your abilities for this competency in deep sedation are is to be able to monitor the patient. Okay, your physicians, CRNAs, anesthesia people are the only ones that can push meds for deep sedation. Your requirements to monitor this patient mean that you have to be at the bedside continuously. The patient has to be NPO for 6 hours, or the doctor has to name this an emergent procedure. You're going to do Q5-minute vital signs while the patient's sedated, and you're going to stay with the patient, and at least for 15 minutes after the last dose of sedation, you'll continue those vital signs for 5 minutes, every 5 minutes. Once that's done, then you can go ahead and you don't have to remain at the bedside, but you do have to come back and check his vital signs and his assessments every 15 minutes for at least an hour. Now, 1 hour after the last dose, if he has not received a reversal agent and he's doing well, he's alert, he's appropriate, he's responsive, his vital signs are within 20% of baseline, you can go ahead and discharge him to home. If he's had a reversal agent, then you need to go ahead and keep him at least 2 hours. You have moderate sedation packets that come along with this. You'll see inside here, there's a physician side for physician papers. On the other side is nurse forms. Make sure you check out the forms that you need, and they're in here. You have immediate pre-procedure assessments, conscious sedation, you have supply papers, you also have a chart that helps you to remember what the assessments and what you're looking for under each type of sedation, and have these forms available before you go ahead and actually do your procedure. Any questions, call 261-6777, talk to us in education, we'll be glad to help. Thanks.